Okay, so I'm going to tell you why it matters that the CDC is no longer recommending the hepatitis B vaccine at birth. A lot of people, the pushback is, hey, parents can still opt into this for this baby. What's the big deal? Well, let me just rewind a bit and kind of go into the data first, right? Back in 1991, we had close to 20,000 yearly cases of hepatitis B. That number is now down to less than 20 per year because of this vaccine. It is highly effective. Billions of doses have been given, and there has been no serious side effects or issues with this. We've obviously tracked those babies who started getting these vaccines decades ago, and they've all grown up to be healthy adults. Now, the first thing that happens when the CDC does not recommend a vaccine that previously was insurance status comes into question, right? So insurance is required to cover everything that is on this childhood vaccination schedule. The CHIP program, the Children's Health Insurance Program, is required to cover it. Private insurances, everyone is. When you take this away from that schedule, that comes into question. Now, my hope is most insurances and CHIP will still cover it, but that's not a guarantee. They're not required to abide by that. And so now we're hoping on the goodwill of private insurance companies, which is never a good idea. The second major issue I see with this is vaccine manufacturers, when something is recommended on the childhood vaccine schedule, and it's recommended because it is extremely safe, this vaccine in particular is extremely safe, it protects the vaccine manufacturers from frivolous lawsuits. This vaccine in particular is not one that is very profitable for the manufacturers of vaccines. They manufacture it, they make a minimal profit, but usually it's kind of going under their category of public good. When you remove these legal protections, what happens is that opens up these vaccine manufacturers to many more lawsuits, money they're going to be spending, and for a lot of them, it may not just be worth their time and effort to continue to make these vaccines for which they get a minimal profit. And so essentially what you will have is, the fear is that many of these vaccine manufacturers will stop making the hepatitis B vaccine, making access more difficult. You're going to lose possible insurance coverage, once again making access more difficult. And then, kind of a broader picture of, quite honestly, this is settled science. The fact that we are discussing this is causing questions, frustrations, confusion, fear for parents. And that is just so unfortunate. There are so many other things that we can be debating, that we should be debating, that we should be funding, that still are under question when it comes to healthcare and the health of our children. This is simply not one of them. And the fact that we are opening up things that are quite simply settled science is just going to lead to declining vaccination rates, increasing cases of hepatitis B, which leads to cirrhosis, long-term chronic liver disease, liver cancer in certain cases, and unfortunately death in certain cases. I hope this doesn't change those number of cases and we don't get back to that 20,000 number, but quite honestly, the cases are going to go up as this goes into effect. Now, this isn't final yet. This is the advisory committee who voted to move this forward. This will now have to be approved by the head of the CDC, but unfortunately, everyone in those positions is essentially rubber stamping whatever is kind of coming down the pipeline. And my fear is that this will be rubber stamped, and soon enough, we will see parents confused or refusing this vaccination, leading to chronic liver disease in babies that otherwise would be healthy. Just wanted to share my thoughts.